You're listening to What is Black, the parenting podcast where we address issues important to raising healthy and thriving Black children and adolescents. I'm your host, Dr. Jacqueline Douge. So thank you for joining us for another episode. Today's episode is sponsored by Puzzle Huddle. Puzzle Huddle creates puzzles that feature diverse Black characters. They believe that when children play with toys that feature images that look like them, they have the opportunity to be affirmed and engaged in imaginative play in a very personal way. And just in time for the holidays, Puzzle Huddle has made Oprah's Favorite Things Gift 2020 gift guide. So pick up your puzzle today at puzzlehuddle.com. If you're looking for another great gift suggestion for this holiday season, check out my new middle grade novel, Learning to Love All of Me, available in paperback and ebook. 12-year-old Sydney Taylor is used to people questioning if she's white because of her light skin and curly hair. After all, no one else in her family looks like her. Despite her physical appearance, Sydney has always known she is Black naturally because her family is Black. But lately she's starting to question her racial identity. From her best friends declaring her hair too white to be braided to a classmate's twisted logic about a racial slur, Sydney is more confused than ever. So when a sales lady threatens to call the police on her mom because of a dispute about whether Sydney is even her child, Sydney is even more perplexed. But when she finds a mysterious picture that unlocks a forbidden family secret, the truth about Sydney finally begins to emerge. As she searches for the answers about her racial identity, Sydney must decide if she can learn to accept and love all that she is. You can pick up your copy today on Amazon, Barnes & Noble, and wherever you buy books. Welcome to another episode of What is Black podcast. I'm excited again to have another fabulous guest. We're joined today by Dr. Sylvia Owusu-Ansah. She's a pediatric emergency medicine physician in the Pittsburgh, Pennsylvania area. And during our conversation, she'll talk about the impact of COVID-19 on children, especially children of color, her work to address health equity, and her upcoming memoir. So I think you're going to really enjoy this conversation. So let's start. So welcome, Dr. Owusu-Ansah. How are you doing today?
Great. Thank you, Dr. Douge, for having me on your podcast.
It is such a pleasure. So in the intro, I shared that you're an emergency room physician, a pediatric emergency room physician. So I was wondering if you could share with us a little bit about your work, especially given this era of COVID-19.
Yes, thank you. So I am, as you said, a pediatric emergency medicine physician in the Pittsburgh area. And COVID has, changed a lot for a lot of us in what we could call ourselves frontline providers. So those of us physicians who deal with COVID up front, even really before we understood what was going on with COVID and who may or may not be positive. And especially in taking care of children, it's been very hard because in being a pediatrician and being a pediatric emergency medicine physician, one of the key things that we do is interact with our patients, interact with the children, make them feel comfortable, maybe even play with them, entice them, distract them. And in the era of COVID, not only do you have to think about your patient safety and the safety of the parents that bring them in, their parents, but then you have to, for me as a mom, think about your own family, their safety, and the potential of you potentially exposing your family to COVID because you are on the frontline services of healthcare and you are on the front line for potential exposure to COVID. We also, know unfortunately that healthcare workers have been at higher risk for having moderate to severe illness from COVID. And we've lost many of our healthcare workers over the past few months. And may they rest in peace. So it is a scary time for all. When you go into a field where you really, really want to help people, make a difference and change, but then your perspective is somewhat changed to where you feel that you have to be a little bit selfish as well in taking care of your own health and preventing the spread of infection to your own family. It makes it a little bit harder to do the work that you do.
So you talk about your role working with children. And many people, I've heard in the news sometimes incorrect information, right, that kids aren't impacted by COVID-19. And we know that parents are going to be sending their kids to school or will be in the process of either sending their kids to school or virtually learning given COVID. So I was just wondering if we could talk a little bit more about that impact that you're seeing COVID-19 has been having on children, and particularly children of color, and how that relates to other aspects of the family dynamic, given the impact COVID can have on kids.
Yes. We have heard and we know now that we call COVID the great revealer when it comes to health disparities, and that is no different for children. And what I want to state here is that COVID is very real. It's very real for the pediatric population, the adult population, the young adult population, and the elderly population. COVID shows no discrimination on which population that it may hit or who may get sick. And so in turn, what I'm saying is that children are affected by COVID. They are affected by COVID in the way of illness. They are affected by COVID in the way of mental health and having to stay at home and not being able to interact with classmates or friends or things of that nature, being cognizant of family members in which they may need to social distance from. So it's kind of taken a holistic effect on children. Children are getting infected with COVID. Many of them, if we look at proportionally, may have mild to moderate illness, but there are a significant number that still have moderate illness that present to our emergency departments that we test for, and even some that need to be hospitalized. In certain regions of the country, those numbers are higher than others. COVID is still affecting our children. Personally, as a pediatric emergency medicine physician, my concern is for the upcoming fall season, where we will also be dealing with flu, which very much has not gone away. And so with that, we know that vaccines can help from a community standpoint. And so I'd encourage families to still continue to get flu vaccines as fall approaches, and being cognizant of flu as well as COVID, and washing our hands, wearing our mask, social distancing, talking to our children about this as well, and the importance of helping out not only their own families and themselves, but our community as a whole.
It's been crazy, the impact it's had on families. And I know you're a mom of young children. How have you and your family been dealing with COVID-19 and all the consequences and life changes as a result of COVID-19?
Yeah, so I have two beautiful daughters, 12 and 8. 12 and 4, excuse me. They are 8 years apart. That's why I use the number 8. Quite a dichotomy there. Quite two different subsets of schooling, right? One is in preschool daycare setting, and the other one is entering middle school, or in some places is already in middle school. And so two different thought processes there. They have been home with me since March, and we have worked with their system in which we know the inner network of the babysitter, and we use masks when we are inside. We wash our hands frequently. Now that the weather is nicer, we spend a majority of the time with the kids outside, or the babysitter does while I'm doing work. But a majority of the time, the kids are home with myself and my husband as we, alternately work from home. My husband is a licensed paramedic, but has kind of switched over to doing home improvement type of jobs, and that has allowed for flexibility, whereas the paramedic would not have. So even that has even affected how our job situation and careers have looked, as I know has affected many families across the country, many who may have lost their jobs completely, let alone even transition to a new job to be more flexible or working from home. So we have tried various methods, like many families. What I do know for my 12-year-old, that and what I became cognizant of, not only as a pediatrician, the pediatrician and the medicine side of me, but as a mom, and I don't want to let go of that fact, is this takes a mental health effect on our children, to be at home, in some cases isolated, not being able to interact with friends in the way that they used to. And I'm particularly cognizant of that with my 4-year-old as well, because when you think of preschoolers and kindergartners, their one purpose in life really is to play and interact and learn through touching and feeling and interacting. And with COVID, that's kind of taken away from that. But that being said, COVID is a very serious pandemic with very serious consequences as sequela. So you want to protect your family on both aspects, which makes it very tough. So trying to find ways to provide outlets for both kids. So for instance, we'll have girls' dance night. We'll have dance parties. We'll make up, certain videos. We'll make up plays and allow them to be creative. They love to read. We spent a lot more family time, and we've become a lot more interconnected with who each other is and is becoming, and what our needs may or may not be. I joked earlier during the lockdown, we never spent lunchtime together, right? Because either at work or at school, and we had lunch almost every day together, which I thought was a beautiful thing. So trying to pick out the positive within the chaos has been trying to be my focus, for myself, my husband, as well as my kids. And so no different than what anybody else has been dealing with. And even more so now with the decision of, going back to school now. In my region, they have decided online for the next couple of months at the very least, and to kind of stair step their way back. And I'm trying to figure out or brainstorm ways in which I could help both of my children in the way of mental health. My daughter's daycare reopened a few months ago and seems to be, as of right now, a well-oiled machine. I kind of wanted to feel that out as a mother and as a pediatrician, knowing a lot. And so I feel comfortable at this stage in time to send her back to daycare, but with a watchful eye. So that's kind of where we are as a family.
Like you said, I think what you bring to the table, not only at your experience with being a pediatric emergency medicine physician, is the fact that you're also a mom, right? So you get to see multiple sides of how this pandemic is affecting families and children, which I think is a great perspective to bring to this episode. But it's interesting to over the summer we've heard people say we're dealing with two pandemics now, not only the pandemic of COVID-19 but also the pandemic of racism. And just wanted to touch a little bit about that as well.
African American female physician, there's only 2% of us, believe it or not, about 2 to 4% of us in the workforce. I believe it's about 2% in the entire physician workforce, because out of all active physicians, African Americans in total make 5%, and we are declining in the number of African American male physicians that we were recruiting. So there is a small pool of us. I am of West African origin. My parents both were born and raised in Ghana, West Africa, and came over here. So I'm first generation. Used to joke African American. And so in growing up that way, in dealing with what we are opening up our eyes to see, I wouldn't say this pandemic of of racism is new. We go back to the 1600s or way before that. So it's not a new thing. Again, the murder of George Floyd and COVID has kind of opened up our eyes once again, and maybe opened up our ears to listen, to see the stories that have already happened and are continuing to happen. And so growing up, I identified personally with a lot of racism. I was told, that I couldn't get into med school because I was Black, and I was also told that I got into med school because I was Black. Two different statements, but both, with racial connotations, both racist statements, right? Like, you got in because of fervent action and it was a token service to you, or you can't get in because you're just not smart enough. You're of that race that's deemed inferior. In coming of age too, for myself, I realized that even within the community, even within the African community, and African American community, there are some prejudices as well. And that a lot of immigrants see African Americans as a lot of Caucasians or whites see African Americans to some degree. And so growing up, I had to wrestle with both sides of that, because I was born and raised in the United States of America. But my parents were from West Africa, and I have strong African roots, and I knew exactly where my roots were. Spent high school in Namibia, Southwest Africa, and witnessed Nelson Mandela becoming the first Black African head of state for that country. And so there were a lot of things and then witnessing President Obama spoke at my medical school graduation as a senator and then became president. So I witnessed a lot of these positive aspects of what African Americans can do and the waves of change. But I also, for a majority of my life, witnessed the detriment of racism on a personal level. And so I worked in the DC area, where I feel privileged, where I was in a community, even though there's a small pool of us in the way of underrepresented in medicine, underrepresented physicians in medicine. I worked at a hospital where I saw a lot of people that looked like me. above me and as trainees. So I saw faculty members that looked like me, administrators that looked like me, saw medical students coming up that looked like me, high school students. When I came to the Pittsburgh region, it was very starking, the contrast between where I'd come from and where I'd landed. In my particular hospital, we African Americans, period, only make 1% of the faculty. So out of 331 faculty members at a top 10 children's hospital, only 1% are African American. And the population for the city in which I serve, the African American population here is about a quarter, it's 26%. I don't know specifically the child population. So you can imagine the pediatric population, I'm sorry. You can imagine these children coming in to this world-renowned hospital, but barely seeing anybody that looked like themselves. I am the only African American physician in the emergency department where I work. There's only a couple of African American nurses. So stark contrast to where I came from. And then I realized how comfortable I was and how, in some ways, sheltered, where I come from. I had done my medical training in Chicago, and there was a great community of professional African Americans there that I got to network with and got to network throughout the nation. And then I came to basically this drought. A very huge contrast for me throughout my medical career, and was not okay with it from day one, and said, we need to do something about this. This is not okay. Initially, when I tried to write up initiatives in the way of like loan repayment for underrepresented minorities to help with recruitment and retention in the current institution that I'm working for, and 3 years ago when I came, and even last year, it fell on deaf ears. And so with this new resurgence, I should say, of I don't want to say appreciation, there should be really appreciation for racism, but the awareness that it still exists, even though we had an African-American president, that wasn't enough. Now we have leadership that's willing to listen, and I've kind of taken the bull by the horns and just run with it. So I see this window of opportunity. And so I had the opportunity to write our first anti-racism statement, inspire lead author and co-author with our most diverse group of physicians, ironically, on our first anti-racism statement for the hospital that's been around for 130 years. I led the White Coats for Black Lives rally. I read my poem. I read the anti-racism statement that we put together for the hospital. I spoke with the CEO of the hospital. And I'm continuing to work on initiatives. Now, I have always throughout my life been involved with the community. From a young age in college, I started an underserved minority mentorship group to expose children in the greater Rochester, New York area to college. So we brought them to classes with us. We had lunch with them on campus to say, hey, you can be like us. You can go to college. I started there, continued in Chicago, continued in Baltimore where I did a public health degree. I've always been a community advocate. I've always had a heart for advocacy. I spent 10 years on Capitol Hill pushing for pediatric legislation, many aspects, and met with many Congress members, men and women, prominent men and women in Congress. That has always been a desire of mine, and this has just been kind of the right place at the right time, especially in a place where there's a significant drought and where lots of work needs to be done. Well, lots of work needs to be done everywhere, but we are significantly behind here. And so now that we have ears that are listening, willing to hear, I've kind of taken the lead on a lot of initiatives.
You mentioned your talk for White Coats Black Lives event. So I was wondering if you could share a little bit about, just educate our listeners, if they're not familiar, what Black Lives for White Coats for Black Lives is, and your upcoming memoir that's sort of based on some of the work that you've been doing.
So White Coats for Black Lives was a rally of physicians throughout, not even the nation, I want to say, throughout the globe, to stand for Black Lives Matter, to stand after the murder of George Floyd, to say that Black lives do matter, that we need to take care of Black lives above and beyond what we've been doing. As physicians, increasing the workforce, as physicians and taking care of our population and being aware of social determinants of health and being aware of health disparities, and not only being aware of those things, but addressing those things, and that we are going to come together as a physician workforce to battle systemic racism in medicine. And so I was honored to be able to lead the pledge in that. And I wrote a poem after the murder of George Floyd because it really touched me, as to say the least. That's not the right term, but as it had the nation. And I wanted to send a message that said, I'll do whatever it is I can do for you. Will you do the same for my Black children? Because I don't look at you on a superficial level. I look at you, with a duty and an honor to take care of you as a physician, to take care of your health, to take care of your mental well-being, to be there as a friend, to be there as a community. I'm asking you to do the same for my kids who are growing up in this in a society that has systemic racism still, or in the pandemic of racism. And so I wrote a poem called "Will You Take Care of My Children," which Dr. Douge, I want to thank you. You posted about literally a month ago, and it will be a month in a couple of days, on your website. So I truly appreciate you giving light to this piece that was from my heart. And from there, I have actually been working on, for the past 2 to 3 years, I have been working on a memoir that basically touches on how the children that I've taken care of have influenced me as a person. Many of the medical books out there are phenomenal, and they talk about patients and their courage of overcoming, particularly in the ways of cancer, death, dying, or even doctors who become patients, that flipped perspective, right, on what it's like to be a patient in our current healthcare system. But few books have touched on how we as the physicians, how our patients have transformed us. There are some books out there. And I wanted particularly to talk about children because they are, to me, the reason why I'm a pediatrician is that children are so resilient. They're so forgiving. They're so open, and in most cases, very honest. And they just want, to be loved, really. Children just want to be loved. And I'm just so privileged and honored to be a part of so many of these children's lives over a spectrum of a decade. But, and as doctors, a lot of times, or even society will say or think that, as doctors, we're doing our patients the service. But I think oftentimes we forget that our patients, in some cases, do us more of a service than we do for them. And that's basically what this memoir is about these children who really changed my life, not even just as a physician, but as a mother, as a human being, different perspectives, and with all different kinds of ailments, and all different kinds of, I have, talked about, the first time I had to pronounce a child dead, and the experience with that, and the experience of, working with the parents on that, or how do you work with the parents on that, or, and as a parent, how heart-wrenching that is, and then children, battling cancer, and how resilient they are, and how they go through these things, and time and time again, they come back, and they come back strong, and some of them don't make it, but even within their fight, they're heroes. In our fractured medical system, in the way of health disparities and systemic racism, and I have a particular piece that I'll soon be releasing on Medium. One of the chapters I'll be releasing called GSW, which stands for gunshot wound, which is about a 14-year-old male who got shot multiple times, and survived it. But when he came to me, I did not know of that history, and he came to me after being detained by the police. He came in basically in shackles with handcuffs and ankle bracelets. Came in with the police for stomach pain after being caught, I guess, in the action of stealing a car, which is what I was told. And he didn't look sick to me. And even I had to wrestle with my own prejudice of there was this connotation of he's just trying to get out of what is inevitable for him. So this is kind of our stop before he actually gets to where he's supposed to be going, right? And so all these thoughts running through my mind. And even I had to step back and say, no, don't get caught up in that mindset of like he's on his way to juvenile detention and that's kind of where he's headed and he's been living this lifestyle. Stop yourself and be a physician. And so that chapter goes on to talk about that. And that child ended up being very sick. And if I had taken to the prejudices and the implicit biases and misconceptions in my own mind, as well as the colleagues around me, including the police officers, you know, this kid would be in a very different position today. And just to even think that he's just a kid, you know, and he survived multiple gunshot wounds to tell the story. I mean, apparently, you know, the bullet went through his heart, his abdomen. He went through multiple surgeries. He was able to survive that. And I met him in a encounter after that. So just all of those things that change you as a human being and help you appreciate your job and who you work with. So.
Oh, that sounds amazing. Oh, I can't wait to when it's available to me.
Yeah. So hopefully within, you know, hopefully by 2021 we'll have that sent to the publishing company. I'm still working on different aspects and have added stuff in regards to COVID as well.
So it's been a pleasure to speak with you.
Thank you very much for the hard work that you do and for this opportunity.
Thank you for listening to another episode of What is Black podcast. Be sure to follow us on social media. We're on Instagram, Twitter, and Facebook at What is Black. That's at WHATISBLK. And also sign up for our newsletter on our website at whatisblack.co. And that's WHATISBLACK.co. And until next time.